Hey everybody, I am Yelena of More Than My Weight, and today I am going to answer one of the top questions I get being a 16-year post-op after weight loss surgery. The question is, why the heck are you taking weight loss medications when you already had weight loss surgery? I'll tell you. So we need to look at obesity as a disease, because it is. And when you look at obesity as a disease, you automatically treat it as a condition that is chronic and needs to be treated. When you look at it from that perspective, all of a sudden that whole lens of like lack of willpower and inability to just eat less and move more goes away, and we become a little more open to the idea of a dynamic perspective of obesity care, right? So eating less, better nutrition, yes. Exercising more, yes. Sleeping better, having better spiritual health, having better emotional health, and going to therapy, yes. But also things like medicine. So I have been able to maintain my weight most of the 16 years. I did regain when I was pregnant with my son because Mama was hungry, and then I re-lost that weight. When I was pregnant with the twins, I did not gain any weight, mostly because I was sick. And then recently, I went through some medical procedures that caused me to gain, and I gained about 30 pounds. So when I did, and as I always say to people who I work with in terms of coaching, is don't go back to your bariatric doctor when you've lost the regain. Go to your bariatric doctor when you need help with the regain, right? So like the number one thing I hear is like, yeah, I'll go back to my doctor when I lose this extra weight. What? The whole point of a doctor is to go get treatment, right? So I went in and I talked to my bariatric doctor. I'm in Minnesota, so my clinic is Park Nicollet. And told them I need some help. I have been doing all the right steps, but I am sliding into my 40s and menopause is likely on the way. And I'm having a really hard time re-losing this 30 pounds, and I would really like to lose it. So we started looking at medications. I tried Saxenda, it worked for a little bit, and then it kind of just stopped working. That's one of the GLP-1s. I tried Wegovy. That one for me worked, but had a side effect of really bad vertigo. I already have vertigo, and I think it just kind of like up a notch a little bit for me. I was not willing to try phentermine because I have just seen and heard about side effects mentally that I was just not willing to deal with. And there are some other ones like Ally and things like that that I don't want to work with because it's like fat absorption type of situations. But I did hear about a medication called Zepbound from a girlfriend of mine who was on it and was doing fantastic. And so I was like, I'm going to try it. And the caveat is she has PCOS, and she said that that was working really well for her. I also heard that it's a medication that's really good for lipedema, like I have in my legs, right? Let me show you. So here are my legs. They are bigger than the rest of my body. I am quite petite up top, and then I have the thicker legs. I will definitely make more videos about lipedema and how you can tell that you have lipedema. I've been diagnosed with stage 1. So I have heard that this medication can actually help with the symptoms of it. So I talked to the doctor. He agreed, and granted, I only had about 30 pounds to lose, but I was in the obese category. And even if I was close to being in the healthy range, he agreed based on the fact that I have slip discs in my back, degenerative disc disease, that the more weight I can lose, the better, right? For me, that's the case. Some people can be a little bit of a higher weight, and that's totally fine for them. It's just not so comfortable for me on my 5'3" frame. So I was 183. Over the last 10 weeks, I've been taking the medication. I've lost 20 pounds, so I am 163 as of today. I would love to be in the 150s, 140 even. I know I tend to look a little frail at the 140 mark, but I feel really good because having the weight off of my back feels fantastic. So the answer is, why would I take a medication when I already had weight loss surgery? Because we try everything to help our disease, right? I kind of make this joke. I mean, it's not a joke, but comparison. If you went into the doctor and they were like, you have an STD, chlamydia, let's say, and they gave you some medication to treat it, right? And you take it and you're like confident, like, yeah, this is gonna get better. And then you come into the doctor and they're like, it's still there. What are you gonna do? Are you gonna be like, shucks, I guess I'm just gonna live with that. Bye. Or are you gonna be like, okay, then give me more treatment? You would seek more treatment, right? But because obesity is such a shame-filled condition that is so concentrated on your inability to do something, you suck at something, you can't do something, the idea of seeking medicine, like an injectable or surgery, becomes this whole shameful thing in society. Like, how dare you? Not only is it your fault that you got fat, now you want to take the easy way out. By the way, if you want to go on my website, morethanmyweight.com, THAN, I just made a t-shirt that says, I took the easy way out, #weight loss surgery. Because sass. And if you know, you know. If you're in the community, you know. Anyway, so that's the reason. The reason is that it's okay to find other avenues. And when I coach bariatric folks, when I speak at conferences, I always bring up the fact that there's no shame in getting a revision. There's no shame in trying weight loss medications. There's no shame in any action that you take to improve your health, because the whole point of obesity management is to feel better, right? And I think the big piece that people have such a hard time with is that when they see that somebody wants to lose weight, especially a person who has never struggled with obesity, their first instinct is like, well, they just want to lose weight. They just want to get skinny. They don't get that we are trying to get healthier, right? Because how can you understand that a person's trying to get healthier if you've never lived in a big body, if you've never lived in an obese body, if you've never had the complications? You don't actually understand that size is tied to decreased health for some people, right? So I hope this video finds you well. If you're in a place where you've regained some weight with weight loss surgery, seek some medicine if you can get it. Not every insurance covers it. Unfortunately, insurance will cover weight loss surgery over medicine. Ridiculous? Yes. But do not fear seeking extra help. If you haven't had weight loss surgery and you want to try medication, go for it. There's no shame in seeking treatment for your condition. Let's repeat it together. There is no shame for seeking treatment for your medical condition. Your medical condition just happens to be obesity, and it just happens to have been totally blown out of proportion by society as a condition, which is sad. But we are here for you. I am here for you. The bariatric community is here for you. So if you have any questions, feel free to comment. If you want me to post on this topic more, if you want me to talk about the different kind of medications there are, I am not a doctor, but I speak at obesity and bariatric conferences. I am a bariatric patient. I am a medicine taker. And I have and will always fight the disease of obesity. And that's just something that's going to be an ongoing battle for me. I had weight loss surgery 16 years ago, but I started becoming overweight and obese shortly after moving to America. Now, there could be a whole discussion on our food system here. That is for another time. All I want to say is that it's okay to seek help for your condition. Thank you guys for joining me, and I will see you next week.